CSOs are concerned that government has not provided proper accountability regarding the utilization and impact of the COVID-19 resources. In a press statement made at the Uganda Debt Network's office in Ntinda, they requested government to publicly account for the loans amounting to $888 million and grants amounting to $14.2 million, all acquired in 2020 in response to the COVID-19 shocks.
As a society, we are very concerned with those observations, and we are calling the government to provide adequate accountability to all citizens. Remember, citizens also provided physical cash, in kind and cash, but also the loans that are acquired are supposed to be paid by we the citizens. So we need accountability to the citizens by the government of Uganda, and they should continue updating on the progress of the implementation of the COVID-19 plans, and also that the people must participate in decision making. We're also calling the government of Uganda to institute investigations into the misuse of COVID-19 resources by Ministry of Health and other agencies, because there are other agencies, not only Ministry of Health.
The report of the Ministry of Finance, Budget Monitoring and Accountability Unit, which says that funds from the regional referral hospitals were characterized by varying unit costs of food that was served to COVID-19 patients, mischarges, lack of accountabilities, duplicated activity reports, doubtful barriers of COVID-19 cases, domestic arrears for hospitals like Gulu and Arua, among others. And by 17th August of this year, Arua, for instance, Regional Referral Hospital, had accumulated arrears of about 278 million on food, refreshments, allowances and accommodation for health workers.
The IEG has powers to arrest, investigate and prosecute. Now, while the institution has been faced with challenges like limited human resources and financial resources, it has made tremendous effort in the prosecution of the corrupt and recovery of some of the embezzled funds. Our concern, however, as CSOs, is since July 2020, when the office of the IGG fell vacant following the expiry of the former IGG Justice Irene Muliagonja's tenure, there has been no effort made by the government or the duty bearers in this regard to appoint a substantive IGG. While the Constitution stipulates that the IG shall comprise of the IGG and 2 deputies, the absence of a substantive IGG affects the independence of the institution, which now has to depend on the Office of the Directorate of Public Prosecutions to sanction cases for investigations.